everyone. Myself, Dr. Krishna Badal. I am the professor in pediatrics in Asia International University, Bukhara, Uzbekistan. So today I like to discuss some MCQ regarding FMG exam. Those MCQs were asked in past year FMG exam. So this is just the beginning, and every after some time I will repeat these sessions, so that I hope it will benefit all of you. So let me start. Okay, so I'll start with question number 1. A 3-year-old child whose weight is 12 kg is having loose motion. So he is thirsty, drinks eagerly, tears are absent, and skin pinch goes back slowly. So what is the best treatment plan for this child? So whenever this type of MCQs are asked, we need to evaluate what is the diagnosis first. So what is the diagnosis here? Okay, see this. So the child is 12 kg and 3-year-old. The child is having loose motion. So clear cut, this is a case of acute gastroenteritis, or you can say diarrhea. This is a case of diarrhea. And during examination, the child is thirsty, drinks eagerly, tears are absent, and skin pinch goes back slowly. So the child is having moderate dehydration. And according to WHO, okay, WHO classification, this is some dehydration. Okay, some dehydration. Now you all know what is the treatment of some dehydration or moderate dehydration. It is ORS. Okay, so ORS is given, but the thing is how much. Now for that we need to look at the option. So look at the option A and B. It is nicely written here: 1200 ml ringer lactate over 12 hours and 600 ml ringer lactate over 6 hours. So this is out of the equation. You know why? Because for some dehydration IV fluid is not given. Okay, so we can easily rule them out. Now there are two remaining options, and let's look at the option C. ORS 100 ml per episode of loose stool. This is the correct answer here. Okay, because this is a case of some dehydration, and we treat some dehydration like this. Okay, so this is a pretty simple type of MCQ. Now let's go to question number 2. Now see here, wide open posterior fontanelle with large tongue and rough skin. Rough and dry skin is seen in which of the following condition? So this is the MCQ here. Now remember, there are certain situation or condition where anterior and posterior fontanelle will be quite large according to the age. Okay, so one of the most common cause is hypothyroidism. And this is the answer here, because we have got some other clues also. There is a large tongue which is called macroglossia. Macroglossia is called large tongue, and rough and dry skin. Okay, this is a feature of mixed edema. Okay, mixed edema. In a baby, we use the term cretinism because the IQ level is very low, but mixed edema is the term we use when the skin is very dry and rough. Okay, so if I consider all the clues which are given to me, then the answer is hypothyroidism. Now a little bit of more knowledge regarding hypothyroidism. Now can you tell me what is the most common cause of hypothyroidism in a baby or a child? And that is, of course, congenital. Okay, congenital hypothyroidism, and the most common cause of congenital hypothyroidism is thyroid agenesis, means thyroid gland is absent. Okay, or thyroid dysgenesis, it is not properly formed. So if a child is diagnosed to be thyroid agenesis or dysgenesis, then the treatment should be lifelong. Okay, we need to continue a thyroid hormone supplementation for the lifelong. Okay, so this is quite easy. Now just to rule some other thing out, what is pellagra? Now pellagra is niacin deficiency. Okay, so vitamin B3 is called niacin deficiency. Down syndrome is trisomy 21. Okay, it is a chromosomal disorder. And rickets is caused by vitamin D deficiency. So why I am explaining like this, because some other MCQ may be having this type of question. Okay, so let's move on to question number 3. Now see here, chronic malnutrition in the child is best evaluated by what? Now, without looking at the option, we can solve this type of MCQ. Okay, now see here. So, chronic malnutrition is best evaluated by height for age. Height for age. Okay, so where is the height for age given here? Okay, it is written in C. So, C is the correct answer here. This is very simple, but we need to find out why other answers are wrong as well, you know. Otherwise, what happens is in some other type of exam, you know, some other options may be correct. So, you may solve it wrong. So, why weight for height is not the proper answer here? Because weight for height is important for acute malnutrition. Acute malnutrition. Okay. Weight for age is also for acute malnutrition, but it is used for chronic malnutrition also, and this is not very reliable indicator these days because it cannot really, you know, distinguish acute versus chronic malnutrition. So, it is not commonly used. And what is ponderal index? Now, ponderal index is mainly used, you know, to distinguish, okay, let me write here, to distinguish between asymmetrical IUGR versus symmetrical IUGR. Okay. Now, you all know what is IUGR. IUGR means intrauterine growth restriction. Okay, the baby is born small, but is it symmetrical versus asymmetrical? That is distinguished by ponderal index. So, let me describe it in another slide. So, ponderal index is defined as or calculated as, you can say, okay, weight in gram divided by length. We don't call height in that age, you know, length in centimeter cube multiplied by 100. Okay. Now, if ponderal index is less than 2, then it clearly shows this is a case of asymmetrical IUGR. Asymmetrical IUGR means the brain is normal. Okay, brain is normal, only the rest of the body is affected. Whereas, if ponderal index is more than 2, that clearly shows it is a case of symmetrical IUGR. Okay, so this is also one of the question which may be asked to you in upcoming exam. Now, let's move to question number 4. Now, see here, neonatal jaundice becomes detectable at serum bilirubin of exceeding which limit? So, the options are 2, 3, 4 and 5. Remember, the question is neonatal jaundice, and you all know this is pretty simple question. In the neonate, okay, jaundice is visible. Jaundice is visible only when TSB is more than or equal to 5 milligram percent. Okay, it is 5 milligram percent. So, where is this 5 milligram percent? Is it D? So, D is the correct answer here. Now, what we call if it is less than 5? Now, there is a term, we call it neonatal, okay, hyperbilirubinemia, okay, but it is not producing the visible jaundice. It is not producing the visible jaundice. To have the visible jaundice, the TSB level should be more than 5. Never forget it. This is a very, very important point. Now, question number 5. Let's solve question number 5 now. Severity of cyanosis in Fallot's physiology is best decided by what? Okay, there are 4 options here, and you have to choose the correct one. Now, a little bit, you know, knowledge about Fallot's tetralogy first, tetralogy of Fallot or TOF. Now, first you need to find out what are the 4 components. The most important component is called pulmonary stenosis, also known as subpulmonic stenosis or right ventricular outflow tract obstruction. Okay, right ventricular outflow tract obstruction. After that, it's VSD, right ventricular hypertrophy and overriding of aorta. Overriding of aorta. Now, dear students, remember one thing. Now, all of these are important, components of tetralogy of Fallot, but which one is the most important for the severity of cyanosis? It is always pulmonary stenosis or subpulmonary stenosis, because it determines what is the severity of tetralogy of Fallot. If very less amount of blood is flowing to the lung, of course there will be less oxygenation and the baby will be cyanosed. So this is the correct answer here. Okay. So let me stop here for the moment. Okay, we'll continue this type of session again. Thank you.